Welcome back and thank you so much for staying with us. Now, malaria has surged sharply in Namibia. Recent figures from the Ministry of Health and Social Services show that 8,760 malaria cases were confirmed in just the first 4 weeks of 2026, a 68% jump compared with the same period last year. Now, health officials report hundreds of admissions and several deaths as the rainy season fuels mosquito breeding and communities in the northern regions grapple with the outbreak. Now, critics have raised concerns about gaps in prevention efforts. Now, to help us unpack the latest situation and the government's response, we are joined by Walter Kamaya, the Public Relations Officer of the Ministry of Health and Social Services. Walter, welcome to Daily Roundup this evening.
Thank you.
All right. Just to start off, Walter, those numbers are quite concerning, but perhaps just to give us a first update on the latest confirmed malaria case numbers and how they compare to the same period last year.
Yes, I like your...
You cannot hear me?
I can.
Okay. Did you hear the first question or should I repeat the question?
No, I heard the question.
Okay.
Yes, can I go ahead?
Yes, please go ahead.
Yes, malaria cases it's getting high. We reported 8,760 cases. If we compare the same period of last year and this year. Last year, this time around, we reported 5,229 cases. And then this can be due to high rainfall that has been received this year. And then when we receive high rainfall, if we have stagnant water around the homes, if we have grasses around the homes, if we have broken bottles and containers where mosquito can breed, definitely this will attribute to high malaria cases.
Now, Walter, what factors are driving the sharp rise?
Sorry?
What factors are driving the sharp rise in malaria cases compared to last year?
Yes, like I've said, high rainfall, it could be one of them. When we receive a lot of enough rainfall, you see that the grasses they are tall whereby, they can create a conducive environment for mosquitoes to breed in. It has been identified also that cattle headers are drivers of mosquitoes, especially in the regions whereby we share a border with Angola. It was identified that these cattle headers, they are the drivers of malaria cases. We know that they do interact, they do come here in Namibia, they go back to Angola and so forth.
Now, just to talk to us about the measures like indoor residual spraying and bed net distribution and community outreach being implemented this season by the ministry.
Yes, the minister rolled the malaria campaign last year in November and December, whereby the indoor residual spraying was being conducted in most of or across all 14 regions. Though that this campaign, it was successful, but in some parts of the country, our spraymen and women faced issues or refusals. Some people did not, or some people were refusing to give access to these people to spray their residential dwellings and so forth. And this now, it could be one of the contributing factor to high malaria cases that we are experiencing now. And then during our campaign, we appealed, we requested to the people, we spoke to traditional leaders, non-governmental organizations, a church faith-based organization to help us to convince the people that they should open up their residential dwellings for our people to be able to spray those places to prevent malaria.
Now, besides from that challenge, are there any challenges with personnel, logistics or supplies that are limiting these preventative efforts?
There could be some challenges of receiving some chemicals late, but the ministry tried everything within its power to be able to procure what is needed. Where we faced a downfall is on the issue of the community cooperation, whereby some community members were not cooperating with healthcare workers, and that posed a very big challenge.
Is there a strategy to monitor and improve spraying coverage and ensure it meets international standards?
Yes, it could be, but the issue is that people should be able to cooperate. There's no standard to say that if you do not cooperate, we have maybe the authority to force you to enter through a dwelling by force. We don't have that. But whatever we do, we have to discuss, we have to tell the community members, they have to ask, they have to accompany people in their dwellings. They have to pack their belongings properly. They have to cover up their belongings so that they do not come in contact with the chemical, because this chemical is harmful. And then they should also be present when their dwelling is being sprayed so that they see to it that nothing has been taken, nothing has been damaged. This effort should be done in their presence. So this is what sometimes we are not saying that it's happening that often, but it's one of the factors that we faced as a ministry.
Walter, are there particular age groups or communities being hit harder?
Yes, the Katima Mulilo district tops up the list of the affected districts, followed by Otapi. For Katima Mulilo district, reports about over 1,000 as well as Otapi, while others reportedly lower than that. And then this could be that, sometimes we are not saying, but we should also try to internalize the preventive measures that the Ministry of Health and Social Services is telling us. When we take heed of those messages, we will be able, if we say that at night, if we advise people at night to put on long-sleeved clothing, we mean it, and then we have seen it. And then these are the guidelines that you have just referred to. But if people disregard such guidelines, in the end, definitely will have a high number of malaria.
Indeed. Walter, thank you so much for being on Daily Roundup this evening and giving us that update.
It was a pleasure having you.
All right. That was Walter Kamaya, the Public Relations Officer of the Ministry of Health and Social Services, just giving us an update on the malaria cases that has been on a rise in some parts of the country. We'll be back with more interviews after this.